Dry eye affects a large percentage of the population as they get older. Anything between 20 and 40% of people over 50 at some time will get dry eye, and in women it's twice as common as it is in men. It's a condition that can be really quite uncomfortable and potentially quite dangerous if it's severe, because the eye relies on being properly lubricated on the front of the eye. The symptoms that you'll get from dry eye are typically those of discomfort and irritation, redness and general unhappiness with the way your eyes are feeling. Typically it's the sort of condition that will get worse as the day goes on, but then there are these days lots of good artificial lubricants that you can use in your eyes in order to help supplement your eye's own tear output to get it back to a level where the eye can comfortably maintain the movement of the lid over the front of the eye. In some cases it's quite mild and you might need a relatively simple product once or twice a day. In other cases you might need something much more significant that gives far more lubricating properties to the front of the eye, and you might need to use that many times a day, even sort of 8 or 10 times a day.
You're saving the hospital service an awful lot of work if you can sort out the dry eyes. It's a natural aging process, but on top of that, if you have an association with arthritis or other hormone loss, you may have even worse dry eyes.
I put higher back in. I wait for about an hour, I would say, before I put lenses in. I do that, and then if the eye is dry during the day, I take it out and put a bit more in.
What did you used to do before you had those products to use?
Just boiled water, still with a cotton wool pad, and just bathe them. But
has it been better since?
Oh, definitely. Yeah,
right.
Most definitely.
Preservative-free is the way to go these days. For a solution that you're going to put in regularly and often, I think you've got to offer your patients a range between thin, that you put in often, and thick.
Okay. So with this is the higher back. It can keep open for 8 weeks.
8 weeks?
So yes,
right.
It's got a special lid there.
Okay.
So when you tip it up, it takes a little while, but just get through to drop it first and then it will drop. When you stand in front of the mirror, pull your eyelid down and just put a drop in as you're looking into the mirror.
It's usually easy to manage and the discomfort of sore eyes can be eliminated. Your optometrist will be able to help you if you suffer from this common complaint.